Hello, everyone. Welcome to our presentation, our Build a Brain presentation on MDMA. So just a little bit about MDMA. MDMA stands for methylene dioxymethamphetamine. So it's a pro-social drug. It's considered a psychostimulant, so it has hallucinogenic and stimulant effects. It's common at raves and is known as a club drug. So MDMA is considered a psychedelic, but it's completely different than, say, acid or magic mushrooms because it doesn't cause any visual hallucinations. And then as for the different street names, it's often referred to as ecstasy, Molly, sometimes MDMA, and there is a difference. So Molly, which is a term that's pretty commonly used, is often a refined crystalline form of MDMA, which is typically more pure and stronger than ecstasy. It comes in multiple forms, including a tablet and pill, powder, rocks, and crystal. I think it's also important to note that most MDMA that is bought on the street is cut with methamphetamine. So, as for routes of administration, ingesting is the most common. So, taking a pill or capsule or crushing the crystals and mixing them into beverages and drinking them. People occasionally snort it and smoke it and rarely inject it.
Okay, so with MDMA, the half-life is about 8 hours, and normally one point is zero point 0.1 grams, but a typical dose is usually 75 to 150 milligrams. And then if you take any dose above 200 milligrams, there's an increased risk of hypothermia, where the body temperature reaches dangerously high levels, and of course, serotonin syndrome. And then the overdose grammage is usually 1 to 2 grams, is pretty lethal. The DEA has this scheduled as a class 1, schedule 1 drug, and it is a stimulant with hallucinogenic properties.
Okay, neurotransmitter modifications. So MDMA is very unique in that it causes big surges of dopamine and even bigger surges of serotonin. So the real key here with MDMA is that massive flood of serotonin, which contributes to the unique prosocial effects of MDMA. So this flood of serotonin enhances mood, empathy, and emotional connection. And then, of course, we have dopamine. Dopamine contributes to its pleasurable and rewarding effects, such as heightened energy and euphoria. We have an increase in norepinephrine, which causes an increased heart rate and contributes to the stimulating effects of the drug. It also powerfully releases oxytocin, which I think is really interesting. Oxytocin is sometimes referred to as the bonding hormone. So you can kind of see how all of those neurotransmitters play into all of the psychological effects of the drug.
Okay. Now, as far as neural pathway modifications are concerned, uh, MDMA affects every single neocortical region of the brain, which would include the parietal, occipital, frontal, and temporal lobes. Beneath each one of these four images, we have listed the primary functions of each one of these brain regions. And as far as how they are affected, if you look under the parietal lobe, the sensory motor functions, somatosensation, so touch, pressure, pain, and temperature. We mentioned earlier that there's, heightened sensuality, heightened closeness and affection. There's heightened senses, so as far as touch and pressure are concerned, I'm sure that there are significant elevations there. There is definitely a heightened risk for hypo or hyperthermia. Uh, which can be affected by this region of the brain. And as far as like spatial awareness and body posture and positioning, proprioception, that's also another function of this region. As for the occipital lobe, this is primarily responsible for our visual functions. It decodes visual signals from multiple areas, the retina, optic nerve, thalamus, frontal, and parietal lobes, to determine what it is that we're seeing and how to respond appropriately. There's significant changes in this region when intoxicated. For example, some folks may experience visual hallucinations, and that would indicate that there's an impairment in terms of what it is that we're seeing and how to respond appropriately. As far as the frontal lobe, this region is significantly vulnerable to the effects of MDMA as it houses, I don't know, our personality as well as executive functions, which include reason and logic, judgment, impulse control, and decision making, all of which are significantly impaired when under the influence and when withdrawing from the substance. Another region of the brain that's particularly vulnerable to MDMA is the temporal lobe, which externally houses a lot of regions that you can see there. They're responsible for like language comprehension, hearing, spatial navigation, recognition of people, places, and objects. Deeper in the innermost regions of the brain comprises the limbic system, which is responsible for emotion processing as well as memory formation and retrieval. And these two previously mentioned functions are significantly impaired as people tend to experience really elevated levels of anxiety and depression when withdrawing from the substance, and there's significant memory impairments as well. And for the next slide, here are the deeper regions of the brain. The cerebellum and the brainstem are primarily responsible for motor control, muscle movements. The brainstem is significantly important when considering the effects of substances because it has a lot to do with relaying information from the brain to the body and vice versa. It's responsible for arousal, so alertness, awareness, consciousness, as well as autonomic nervous functions, so digestion, bladder, and bowel controls. Um, the basal ganglia is the region of the brain that's responsible primarily for reward and reinforcement. The caudate, putamen, and nucleus accumbens have a huge role in terms of habit formation, uh, uh, learning, as well as developing addictive behaviors. As for the limbic system, there's significant impairments here, as mentioned before, especially with emotion regulation, memory, formation, and retrieval. Uh, uh, as well as the autonomic nervous system, like increased heart rate, blood pressure, uh, and breathing rates when intoxicated. Um, and then on the next slide, here's something that's fascinating from a study that we found about how MDMA affects the corpus callosum, which is the region of the brain that connects the two right and left hemispheres of the brain. There's this concept, this thing called fractional anisotropy. And what that consists of like increased myelination of the fatty tissue surrounding the neurons, increased axonal density, so the regions that send information to and from one another. It also increases how cerebral blood flow and fluids and just water diffuse from cells. So what sounds like a great thing is actually pretty dangerous. Uh, uh, Fractional anisotropy decreases as the MDMA frequency and dosage increases. And so with chronic and persistent use, uh, approximately 6 months or so, there's a lot of increased activity within the highlighted regions that are highlighted in red. So there we can see literal pathways being drawn and connected between different regions of the brain via the corpus callosum, which is rather astounding because that actually is what significantly increases the likelihood of addiction, the likelihood of experiencing uh, long-term health consequences with these substances.
So with mechanisms of action, when MDMA is ingested, it goes down to the tummy. And MDMA is a weak base, so the stomach acid gives it an extra hydrogen ion. And once it's in the stomach, a tiny, tiny part of it's absorbed, but for the most part, it remains intact. It passes down to the small intestine where it loses that hydrogen ion. And from there, it goes into the liver where it's processed. And then once it is processed, it goes up to the heart, which pumps it out to the lungs. And then MDMA is oxygenated and sent back to the heart where it gets sent to the brain. And if MDMA is ingested on an empty stomach, it can effects can appear as quickly as 15 minutes.
Alrighty, so the cognitive impact. So I'm going to be using this brain model just to kind of explain what an intoxicated brain looks like. So as I mentioned before, we have an increased activity in prosocial areas of the brain. So of course we have the prefrontal, parietal, and the occipital lobe. Primarily the prefrontal cortex is affected, which is associated with decision making, social behavior, and emotional regulation. MDMA enhances emotional openness, which is likely attributed to the impacts on the prefrontal cortex. So on the back, we have the limbic system. So the limbic system helps detect danger and control our emotions. So it's kind of interesting. With MDMA, we have decreased activity in threat detection areas of the brain, such as the amygdala and the hippocampus. This can result in an increased empathy for oneself and others, along with trust. Um, and then I'll just dive a little bit deeper into these two areas. So we have the hippocampus. Something interesting about MDMA is studies that have used MDMA clinically for PTSD have shown that traumatic memories are less threatening when under the influence of MDMA, which obviously is why sometimes it is used for PTSD. But I think it's important to note that this only works if it's in a clinical setting. And then as far as the amygdala, this is the brain's smoke alarm. So it plays a key role in processing emotions and, of course, threat detection. This stimulation results in, again, an increase in trust for others, and it decreases fear responses. Um, and then with all of these impacts, some of the effects are, that increased self-esteem and confidence, intense happiness and pleasure, feelings of acceptance for oneself and others, intimacy, heightened senses, without feelings of detachment from reality and environment, which is often associated with other hallucinogens.
And with the social and emotional impacts, just to uh, piggyback off of what has been discussed already, um, the amygdala, when activated, um, is what is primarily responsible for uh, essentially telling the hypothalamus to tell the pituitary gland to tell the adrenal glands to start releasing adrenaline or epinephrine, and plus cortisol, all of which are responsible for activating the stress response to fight, flight, or freeze. Now, when consuming MDMA, there's the kind of a reverse effect where there's an increase in, dopamine, serotonin, oxytocin, and norepinephrine. And norepinephrine is responsible for kind of the more of the rest and digest. So the, if you can see here, the relaxation, the sociability, intimacy, closeness, euphoria, arousal, empathy, acceptance, confidence. All of these are sort of the immediate effects that people can experience when consuming the substance. Now, so as far as like long-term effects, there is a depletion of uh, specifically dopamine and serotonin, which can contribute to some really severe, highly intense anxiety and depression-like symptoms.
Physiological impacts. So under the influence of MDMA, an individual's muscles are going to tense up real hard, and they're also going to clench their jaw. There's often nausea that will come with it, and then their pupils are going to get super dilated. They could have blurred vision or nystagmus, which is where the eyeball moves involuntarily. There could be an increase in heart rate, and also agitation symptoms may appear. Dry mouth, dehydration, and again, hypothermia, where heat exhaustion will also be very relevant. There could be faint fatigue and also faintness with chills or sweating accompanied with that. And then developmentally, there is an increased risk of mood disorders later in life when MDMA is consumed often. And along with that will be cognitive deficits, like learning, attention, and working memory. They're all going to be impacted negatively. And there will also be a decrease in emotional regulation, and it will become very difficult to cope with stress or any kind of negative emotion. And along with many substances, over time there will be a tolerance increase. So in the future, you have to take a lot more of the MDMA to feel any kind of effects from it. And then over time, it will decrease your natural dopamine and serotonin production. So that messes with it. When you're not on it, you're going to have very intense cravings because all the good feelings that you had before having MDMA, now your body is no longer naturally producing them.
Now, all of these cognitive, social, emotional, and physiological impacts are just so reflective of what most people experience during heightened levels of anxiety, panic attacks, or depressive episodes, or shoot, even bipolar related disorders. And so it's just so imperative, so important that we conduct a very thorough assessments during the diagnostic phase of treatment, a minimum of 3 to 4 sessions, just to really understand what is underlying all these symptoms, what's contributing, and if there's anything that could uh, better explain what it is that a person is experiencing. Because often a lot of folks will come in to appointments complaining about these different alterations and changes in their mood, well-being, and their mind, their body. And so it's so important that we conduct, thorough assessments for any sort of substances that they may be using that could be contributing to their symptoms. Now, if folks are, if they report a history of medical complications or a history of physical health problems in tandem with their social, emotional, or behavioral or cognitive issues, it's so important that we assess for the onset, the frequency, duration, and severity of each one of these symptoms. When did it all start? How often is it happening? How intense does it get? And to what extent does it affect them, socially, academically, and or occupationally? Now, we alluded to the different routes of administration. A few of them here include nasal, oral, or injection. There are certain health complications people can experience when using MDMA in these particular ways with intranasally. There's sinusitis, uh, inflammation in the nasal cavity, irritation or bleeding of perforated nasal septum, so the bone that divides the two nostrils starts getting holes within there. There's smoking, uh, which could include respiratory problems, coughing, bronchitis, pneumonitis, pulmonary arterial hypertension, so really high blood pressure. With injection, it's not as common, but if it is used that way, there could be puncture marks known as tracks, which can lead to skin infections as well as HIV, hepatitis B and C, tuberculosis, uh, especially if not only the IV injections or if there's an unsafe sexual activity. Some other symptoms that clients may report is weight loss and malnutrition. These ones are particularly common, which could also be confused with depression-like symptoms, or perhaps even eating-related disorders. There could include chest pain, myocardial infarction, palpitations, and arrhythmias. So irregular heartbeats could be confused with panic disorders. So important, and perhaps high levels of anxiety. So important to know if it's the MDMA that's the underlying cause. At its extreme, there's sudden death from respiratory or cardiac arrest and or stroke. We mentioned temperature changes, so there's the chance of hyperthermia. There's neuroinflammation and neurotoxicity in dopaminergic and serotonergic neurons. Of course, clients would not complain of that openly, not knowing what's going on in their brains, but this could be a very real thing that's happening in as little as 2 to 3 weeks of use. Lastly, there's just oral health problems that could include gum disease, tooth decay, mouth sores. That might be more of a common presentation for folks who drink the beverages. Um,
All right, here are our references. Hope you enjoyed our presentation. Thank you.